Good morning and namaste to everyone. I'm Hari Joshi representing the Animal Nepal. My subject for presentation is engagement of the stakeholder through advocacy and education facilitated on recognition of the disease and reduce the number of glandular cases in Nepal. This may be the old one. First, I would like to introduce about the Animal Nepal. Animal Nepal is a pioneer animal welfare organization in Nepal working towards the ensuring the welfare of the animals. We are working to ensure the welfare of the working animal, basically donkeys, mules, and horses. We work for the welfare of the farmed animal. We do the dog population management. Under this, we do the neutering and vaccinations programs, and we do the lot of advocacy and research. Nepal animal welfare issue is in the very initial stage, and there are a very limited protocols, policies on the animal welfare. We don't have the Animal Welfare Act also, so Animal Nepal is doing a lot of advocacy to have policies, protocols, and act. And regarding the there is a new slide. I have checked. This is not a right slide, yes. Sorry for technical error. Otherwise, it's okay. I can go ahead. It's okay. Yeah, this one is. And regarding the equine phenomena, glandular generally seen in the, initially seen in the equines, and the equine phenomena in Nepal is, we don't have the breedings. In Nepal, generally the Nepali equine owner, they buy the equines from India, and during the breed production seasons, the Indian equine owner are also coming to the Indian in Nepal's in the different breed industries. India and Nepal do have a 1800 kilometer border, and we do not need any legal paper to cross each other. And there are 22 official transit points. Out of that, only 6 have the quarantine services in Nepal. So generally, the equine owner from India, when they arrive, they do not pass by the quarantines. So in terms of the equines, in terms of the glanders, we need to have a different stakeholder engagement. Without the different stakeholder engagement, the glanders problems has not been solved in the Nepal, because we have to work with the Indian equine owner, Indian authority, Nepal equine owners. So generally, the equines movement in Nepal happen a lot. Generally, equines from this area, Indian equine also coming from this area. In this part of the India is the Uttar Pradesh and Bihar. There are a lot of equine fair happening every year. So Nepali equines owner from this is the Tarai area comes here to buy the equines and they bring the equines here. And in this area there are a lot of brick industries. So the equines generally works in these bricks industries during the brick production season, which is starting from December to before starting of the raining, which is the June. So from here, the equines in Nepal are here and in the high mountain area. Generally, the equines work in the brick industry. After the end of the brick industry, the equine owner from the mountain area comes here to buy the equines and they bring the equines. It means the glander from India to Nepal, Tarai region, then Tarai region to high mountain area, it is going to be transmitted. So the organization like us, we need to do a lot of collaborations with the different organizations, and without the involvement, without the education of the large number of stakeholders, this phenomena, this glander cannot be resolved in the Nepal. So, as I told you, the glander is the infectious disease, and glander in Nepal was recognized only in the 2021. We did a lot of advocacies with the support of the donkey sanctuary, World Horse Welfare. We have done a lot of advocacy, and finally the government was ready to collect the samples and bring it to the OI lab abroad. After the OI lab in abroad recognized the presence of the glander, then the government has officially recognized the presence of glander in Nepal. Then after only we have started intervention on the glander. Before that, even we know that glander exists. Our vet are working on the field and they identify the symptom of the glander. They suspected a case. Even we know the glander, but it was very difficult for us to do the interventions. And there was no testing facility because the government did not recognize it, and there was no lab which confirmed the cases of the glander. Quarantine officers were not trained on the glander, so they were not aware about the symptoms and other things. So there was no resources for the glander intervention at the moment. It was the donkey sanctuary and the World Horse Welfare who supported us to recognize, and then after do the activities on the field level. So when we, start advocating with the government for the recognizations, we face a lot of difficulties. One is there is a lack of statistics number of working and migrated equine. It has been said that Nepal do have 80,000 equines, and during the brick clean seasons, 30,000 equines from India also come to the Nepal for the working. So, but this is the estimated data, and because the government, the authority, they don't have a proper data keeping system, so we don't know at that times that how many equines we do have. In Nepal, still the livestock is more priority because the equines are the working equines and they are not under the livestock. So we were facing very difficulties that where we to go for the advocacy and educate the government peoples. When you go to the agriculture ministry, they have told us that these are the equine owner, you have to go to the transport ministry or the Ministry of Industry. But Ministry of Industry and the transport ministry said to us that these are the animal you have to go. So there is a confusion. So we got a lot of difficulties, challenges while working on the glander or equine issues. And there was no testing facilities before the glander was recognized. Later on, the government has buy the testing kit, then only we were able to test the suspected case of the glanders. And before the glander was recognized, there was no any other agency work for the glander issues. Animal Nepal's, the Brook Partners, Donkey Sanctuary, sanctuary and horse welfare are the only organization, but these three organizations are outside. They cannot do anything, but they did a lot of back supporting, mentoring us to do some things on the Glander issues in Nepal. So but after the Glander was recognized, it is little bit easier for us because the FAO come on board. Once the FAO come on board, the UN agency, the government come on also on the board. When there was a lot of pressure from the UN agencies, because after the recognition of the Glander, there is a compulsory mandatory process for the Nepal government to report the Glander cases to the OIE. That makes the government go forward on the Glanders. So we have also done, and we have supported by the ICWE. ICWE is the International Coalition for Working Equine, which is based in the UK. Because in Nepal, when the Glander was recognized, there are the very limited peoples and organizations, they know about the Glander. We don't have the IC materials, we don't have anything. So we need to support by outsiders so that we can provide the education to the higher number of people. Even the government officer, they do have a limited information on that. And what we got a learning from during the recognition of the Glander, that if we have a back supporting from the UN agencies, then it will make our work little bit easier. Nepal is a very, least developing countries, and even the government do not have a resources, and the UN agency play a vital role. They have a much more influence power. Because of that, the government, right now we do have the federal systems, federal government, state government, and local government. Before the recognition, before the FAO is on board on the Glander intervention, it was very difficult for us to work with especially the province and local government. But after when the FAO comes together with us, we have done a lot of activities on the Glanders. So, what we face challenges even after the recognition of the Glander is that we don't have enough educational material, training material on the MTOT. Master of Training of Trots, and no existing mapping of the equine, lack of the knowledge of the phenomena of the equines in the Nepal. We know Nepal has a lot of equines, but there was no mapping of the equines. There are around 1,200 brick industry, and out of that, around 30% brick industry use the equines in Nepal. Apart from that, in a high mountain area, there is no road access, and these equines are the only means of transportation in the high mountain area. So even at that time, nobody, government officers, no other NGOs have. We, as Animal Nepal is working on the limited districts. We do have data on our districts, but out of that, it is very difficult for us to figure out where the equines are. And the problem we face, especially on the Glander, is the long open border. And there is no controls of any agency on the border. So actually the equine owner in the other side, India, they are also the very poor communities. And when they bring the equines, they bring the very poor equines in the Nepals. And these are the equines who transmitted the Glander into Nepal. Last year we had one case study that we have done. The first, our vets saw the one suspected case of Glander in the one brick industry. Then we kept the samples and it was tested positive. Then we did the screening of the another 12. Out of 12, we found the 11 equines were infected from the Glanders. So out of that, 50% were from the India. So it means that in terms of the Glanders, generally the Glanders is transmitted into Nepal from India, especially from Uttar Pradesh and Bihar area. And because now Glander is recognized, there are a lot of stakeholders. In the brick industries, during the brick clean seasons, around 300,000 people got the jobs. So these are the people, are the vulnerables for the Glanders. So as a small organizations, we have a very limited resources, but we need to work with a different stakeholder and a large number of beneficiaries. So this we have found the challenges. And another things we have found that the engagement of the organization working on the public health. We went different time with the public ministry, and we don't have any evidence that this glandular has transmitted from animal to human. We have done the researches, and we have found that the transmission rate from animal to animal is very high in the glandular, but transmission rate from animal to human is very, very rare. And there are a very less evidence. Even there are a lot of death cases because Nepal is a Hindu country, and around 88% are the Hindu and very limited are the Muslim. And inside the Muslim also, Kashkar community who have equines, they are the minority groups. And generally when there is a sickness in the community, instead of going to the public health department, they go to their own traditional health. So even they go to the India for the health checkup. That's why even we know that there are some death cases of the human, but because of no testing of this human, it was very difficult. It was very difficult us to produce the evidence that the glandular has transmitted from animal to human. Because of that, these public health organizations are very limited interested on awareness, educations, and even the on board doing the mass awareness on the glandular in Nepal. So the glandular was recognized during the pandemic period, 2021 May. So it was because it was comes from the animals, the disease, and the country was locked down for a long period. That's why also we have a lot of challenges and difficulties when we have done the activities on the glanders. So I'm going a little bit fast. I mean, after we have done this engagement, we have a big result that large number of vet and vet technicians were trained through our project across the country. And mapping of the equine and risk assessment of the glandular and transmission and estimation of the financial impact due to the glandular in Nepal has also been done. And screening of the equines has been done. We have done, we supported the FAO to do the screening of the equine in the area where there are more concentrated the equines. Not in across the country, but we have chosen around 5-7 districts where equine population have more concentrated. And the result was, if I say the result probably is like a pandemic. So even it was very difficult to disclose this, because if we disclose this kind of things, the people have because it is COVID has already depressed the peoples, and this kind of things will also depress people. So even there are the high number of glandular cases, we have to go slowly. The another good things happen is that regional lab are in the process of upgradings. Right now, the testing facility is only happening in the Kathmandu. Out of Kathmandu, there is no testing facility, but under the FAO project, this regional lab is going to be expanded. And another is government is on the process of drafting the Infectious Disease Control Act. We didn't have an Infectious Disease Controlling Act. This glandular recognition make a base to develop the Infectious Disease Control Act. So now the euthanasia, we don't have the policy for the euthanasia of the animals. So this helps probably to push the government to have policies, and we don't have the compensation policy. Because of no compensation policy, it makes very difficult for us to recommend the beneficiary for euthanasia. So these are the result after we engage the different stakeholders in Nepal. And the other thing is that before the educations and capacity building of the government was not allocated any budget and resources for the glander. So right now the government has allocated the program and programs and budget for the glander, which is help to sustain the glander interventions in Nepal. So what other challenges we have faced during this recognition of the glander and education, that equine community is a very poor community. Their all development indicators are very low. Sanitation is very low, education level is very low, and they are inside the Nepal, they are the most backward society. So educating them, it takes a lot of times. We have done a lot of, and we use a different type of activities to educate and engage them, especially on the glander. And the equine users in Nepal, generally they do not care about, because they do not, the equine owner, they don't have a directly contact with the user. Generally the middlemen who works on the behalf of them. So these are the education's things we have done. Conduct the different education and the equine owner in the cleans and the stakeholder. We use the IC material. We use the radio also, so FM radio, and we did a lot of training to vet and vet technician, especially the government, so that reporting system, at least if there is symptoms, they can report to us or report to the authority, so that the sample can be collected and bring it to the lab. So these are the main result after we done the educations and the engagement of the stakeholder, especially on the glanders. So there are some photo. These are the vet technicians trainings, and this photo, in the bricklins, now they have the practices of the isolations also. The beneficiary have a practices of the hand washing, this kind of thing, so that the transmission cannot be comes to the humans. So generally in the bricklins there is no isolation center, so the beneficiary has making this kind of isolations, so that the infected one cannot transfer the disease to the other one. So sorry, the time is up also. Thank you. Thank you very much for listening.
Mr. Hari.